Hi guys, this is Swati Rao coming to you from Be Well Family Care. This is our third video in our COVID-19 series. Thanks guys so much for all your love and all your support and all of your really thoughtfulness about keeping us safe and keeping yourself safe. We are so proud that you're our patients. So today I want to talk to you a little bit about our hopes and our fears and try to replace some of those fears with knowledge and with data and talk to you a little bit about what's coming, what I'm excited about, what I'm maybe a little worried about, and then really finish off with some of the things that we can do to really stay healthy. So I'm going to share my screen here with you. Hopefully you guys can see that. Let's start with what's going on in the world. So these statistics are staggering for sure. So in the world right now, we're seeing a little over 900,000 cases of confirmed COVID-19. So SARS-CoV-2 as a virus is definitely spreading. There's still an uptick in the world as we see it. And at this point in time, there's over 45,000 deaths in the country. Italy is still leading our death toll right now. So let's look and see what's happening here in the United States. So at this point in time in the US, our curve is also streaking upwards. We have a little over 205,000 confirmed cases of coronavirus. But remember, if you see that number go up, that might be because we're actually able to be doing more testing. So you take that number with a grain of salt. At this point in time, the scary number is that we've had about 4,500 deaths in the country. So where are those deaths and what's been happening with those curves that we keep talking about? So as you guys know, our big cities really got hit hard. I think New York being especially one of them. I think that one of the reasons why New York is getting hit so hard is because I think that it actually saw this crisis way before the rest of the world did because of the influx of people from out of the country, potentially going in, just the nature of how small New York is, and the nature of the fact that it was very hard for them to social distance. And so right now we're seeing a lot of deaths in those areas. But if you're looking at what's happening in Seattle and in California, in LA, you'll start noticing that their death curves are really flattening because they were able to very early start to social distance. And I'm hoping that's what Indiana will look like. So what's happening from a standpoint of Indiana? And so we are down here in one of these gray lines. It doesn't seem like it, but that's where we are right now. I couldn't find a graph that really just isolated us away from New York, just to give you guys a comparison. So, but if you're looking at Indiana right now, we've had about 2,500 proven cases of COVID-19, about 65 deaths, and we have tested a little over 14,000 patients. And so this is kind of where those cases are by county. This is a map as of this morning. And so pretty accurate numbers. And so I thought this was really interesting. This is the demographic of where we're finding these cases in the state of Indiana. So in Indiana, we're finding that the majority of our deaths are happening with people that are over the age of 60, and we really need to be cautious for patients that are over the age of 80. So really protect our elderly. Unfortunately, some of these younger ones that we're seeing, I think, are healthcare providers. So remember to keep those guys in mind as well. From a standpoint of demographics, we're seeing very few young people infected or positive with this virus, but we're also not testing young people. So some of those that are being tested, I think, are being tested based on circumstantial type of evidence. This is interesting. I have not seen this on a world trend, except for in Italy. But if you're looking at the number of cases tested, you'll find, or positive, you'll find that there's a pretty significant number of women over men that are testing positive for COVID-19. Who knows if we're just getting tested more? But if you're looking at who's dying, there's a significant increase in the number of men that are dying over the number of women. My gut instinct is that's because there's higher hypertension, heart disease, diabetes, sometimes in our men. In Italy, they have very similar trends. They attributed that to the smoking rates of a lot of people in Italy, a lot of men in Italy. So how many tests have we actually done? This tends to be a source of debate when you turn on the TV. When we're really looking at how many tests that we've done, as the United States, we're way down here. we are, I don't believe, doing a great job with testing. Right now, we're getting better and better. I think over the next 2 weeks, we're going to talk about this. I think there's going to be a lot more testing. So I'm looking at places like the United Arab Emirates and Iceland to really try to gather some data on how this is really presenting in the overall patient population. So let's look at Iceland, for example. Iceland is testing a mass number of patients, not just the people that are really ill or people that are at high risk, but they're testing everyone. And what they're finding is that in Iceland, 40 to 50% of the people that they're testing that are positive are completely asymptomatic. And I think that's one of the reasons why this is spreading so quickly is, let's face it, if you have the flu, you're feeling pretty miserable. You're not going to be walking around, or you're going to be very cautious to keep yourself at a distance from everyone else. So at this stage in the game, I want you guys to pretend like everyone has COVID-19, not necessarily in that they are the enemy, but in that we want to really social distance ourselves and make sure that we're keeping this virus as under wraps as we possibly can. So testing. This is my prediction and my hope. Is that I think in the next 2 weeks, we're going to see a robust changing in testing capacity. I'm hearing a lot about self-testing options that might become available. I'm really hoping for this, that you'll be able to go to the pharmacy and if you're symptomatic or even if you're not, be able to do a nasal swab test on your own that you can send in. We're thinking that those will take about 3 days to turn around. I'm almost visualizing us doing a virtual visit with you while you're doing the test and then talking about it afterwards. But I just think knowledge is power, and a change like that can be really, really important. We're also seeing more rapid testing coming about. Abbott Laboratories announced a few days ago that they came out with a test that can be turned around in about 15 minutes. The data that I'm seeing is that it might lose a little bit of the sensitivity than the gold standard test, that's the PCR test that we're doing right now. But that PCR test for us anyways is taking upwards of 7 days to come back. I think there's just simply going to be more tests available because we've had more time to be able to really understand and be prepared for this. I'm really excited because they just came out with a new test called an ELISA-based test. PCR testing, guys, is testing where you stick that swab up your nose. We've had some reports that they're doing PCR testing based on throat swabs or even stool cultures. But that is, if you are infected with the virus, then that virus is going to show up on that test. I think it's really exciting that there is now an ELISA test that's being studied that's going to be serologic, so it's going to be blood. It's not going to test to see if you have the virus. What it's going to test to see is if you have the antibodies for the virus. So have you had the virus? Are you recovered from it? And more importantly, is there antibodies for it? We have no idea right now if those antibodies will mean continued immunity if this virus comes back next year or whatnot, but there's a lot of hope that there might be some potential there. There's even some treatment options that are talking about utilizing a patient that might have contracted coronavirus and actually recovered from it and using those antibodies for treatment for severely sick people. So, for me, knowledge is power, and knowledge means we have more control. So that's the reason why we're going to bring you a little bit more knowledge today. So, oh, by the way, thank you to Eli Lilly for making this amazing drive-through test available to healthcare providers. They've just increased that to all frontline workers. So people that are symptomatic that might be working at the grocery store, pretty much any of those essential jobs, if you're symptomatic, Eli Lilly with a doctor's prescription will be able to do these really cool drive-through tests. They have, call this number. So there's very little interaction with the people that are there. And they've essentially turned one of their parking lots into a testing center. I just wanted to send up a kudos to them. I think they're doing such a fantastic job, really organized. And so we really appreciate that. So treatment, what's in the works? What do we know? And really part of what can we do today? To really get going. So unlike what you're seeing on TV, there are many, many, many different trials that are going on right now. Guys, the amount of research that I'm finding, the amount of journal articles that I'm finding between February and now, it's mind-blowing how many people are out there working to keep you safe and to give us more options. So there are just so many clinical trials being done right now on antiviral agents, like the types of things that we use to treat HIV, anti-malarial drugs. We'll talk about chloroquine because I know everybody wants me to talk about chloroquine. We'll talk about even blood pressure meds. Are they good for you? Are they bad for you? We don't know. We're running some trials to find out. And like we said, even using things like our own antibodies to be able to help us. And then, of course, there's supplements that are being trialed right now as well. So, you know, you can't get away with the video from me without getting some biochemistry or some anatomy. And so here we go. So to really try to explain to you how some of the drugs that we're looking to help us in this, we have to go back and understand our DNA and our RNA and how we make proteins. So remember, humans have DNA. That DNA lives inside the nucleus of the cell. So the kind of peach looking thing there is a cell. The purple thing is the nucleus. So the nucleus houses our DNA, which is what we get, one strand from mom, one strand from dad, and it basically houses our capacity to be able to make proteins, hormones, what we look like, right? It is basically the essence of what we're made of. But DNA can't travel outside the nucleus. So how DNA transcribes proteins is DNA basically goes through a process called transcription and makes RNA. The RNA then travels outside the nucleus into the cell, and it goes to a place called the Golgi apparatus, right? That rough ER, if you were in 8th grade and you remember that. And on that rough ER, there are ribosomes. And those ribosomes go down that RNA and read it almost like it's a book, like a code. And they basically translate and make proteins. Proteins are sort of the way we get things done in our body. Those are our worker things, right? There are our hormones, our enzymes. They make reactions go faster or slower. They essentially are how our body communicates. So that's how humans do this, through our DNA. But what does coronavirus do? Remember, coronavirus has RNA, that lipid cell membrane. Whoops, sorry about that. And these little spike proteins, right, that we've talked about. By the way, some of those treatment options are actually looking at this binding site of spike proteins to see if we can change the receptor so that those spike proteins can't bind to that ACE2 receptor. But when coronavirus binds to that ACE2 receptor, its RNA goes inside our cells. Now, our cells don't know the difference between our RNA and the virus's RNA. So guess what we do? Our ribosome goes in and starts to read that viral RNA just like it would read ours. And it makes, of course, protein. The very first protein the coronavirus or SARS-CoV-2 makes is a protein called RNA dependent, because it's got to be dependent on its RNA polymerase. This RNA dependent RNA polymerase protein then allows our cells, using our machinery, to make more RNA. And when this RNA is made and it gets read this way, it can actually start to really make more protein. Once our cell has made enough RNA and enough protein, making this simplistic, coronavirus can then leave our cell and start invading all of our other cells. So this is how we become infected. This is how we get sick, right? And so what can we do today? And what are we working on to really see if we can inhibit that process? So there's a lot of talk about zinc and chloroquine. So zinc, guys, comes into the cell and it inhibits RNA polymerase. That's a pretty huge thing, right? And so if that can happen, then the RNA can't make more RNA, and we're going to reduce what's called viral shedding. That's what you're hearing about. There's less virus to go around if we can get enough zinc inside the cell to be able to block RNA polymerase. This is what chloroquine is doing. So chloroquine is a proven zinc ionophore. What that means is it increases the concentration of zinc inside the cell. And so that's the reason why we're seeing reduced viral shedding. But remember, guys, we're only seeing that inside of a lab and in some very small studies that, if you're really reading them, there's 1,000 holes that we can poke into. I've only really seen 2, and one of them wasn't really even a study. And so, but this is where, when you have someone that's pretty sick, this is what we're using right now to be able to buy some more days. I know that there's a lot of demand to start using chloroquine more and more. I'm not sure where I'm going to stand on that, but I'm going to keep researching it for you guys. But I have some other suggestions. So are there other ways that we can increase intracellular zinc levels. So of course we know that chloroquine is one of those things that can do that, but there's also getting more zinc in our system. Increasing extracellular zinc in those same studies has also shown to increase the amount of intracellular zinc that you can have. So where do we get zinc in our food? Because it should always be food first, right? So we can get zinc in our meat, try to make it pasture raised. We can get zinc in our shellfish, try to make sure that it's wild caught. We can get it in our legumes, please soak them. We can get it in our nuts and seeds. Some of my favorite things are sesame seeds and pumpkin seeds and pine nuts, cashews, almonds. These are all great sources of zinc. And also from our eggs. Make sure that they're pasture raised and omega-3 fortified. And also you can get zinc in potatoes, sweet and regular. And then the question that everyone is going to ask, I don't know, but I think that when you use a chelated zinc, like in our reacted zinc, that is also going to increase the intracellular levels of zinc. We've been using reacted zinc in my office for years. Most of you guys are familiar with that product. And when we check red blood cell concentrations of zinc in your blood, when you take that supplement, those blood zinc levels go up. So my presumption then is that if we start taking reacted zinc, that we might be able to get elevated levels of zinc inside the cell. We don't know this, but I think that that's a far safer option than everyone taking chloroquine, which by the way does have side effects. You want to make sure that you've had an EKG on file before you take chloroquine. You want to make sure that your potassium levels and your magnesium levels have been checked and you know what your baseline is. And that way, because chloroquine can reduce that and cause hypokalemia, hypomagnesemia, it can also cause EKG changes called QT prolongation. So these are not things that come without side effects. So remember, what is it that we're doing right now? We're working on drugs that can inhibit zinc concentration. We're working on drugs that work at the ribosomal level. We're working on lots of drugs that might affect the spike protein of the coronavirus to make it so that it can't bind. We're working on things that might alter receptor sensitivity. We're also working on things for immune protection, right? So there's a lot of things that are going on out there, but what can we do today? One, remember, viruses are obligate. They cannot survive without us, right? They need our machinery to be able to reproduce, to be able to replicate, to be able to become a nuisance to us. So the first thing we can do is to really reduce viral contact. And that's why we're social distancing. And thank you to all of you guys for doing such a good job with this. I feel like we got this, especially for our patient population, as early as we knew to do this. We're using virtual visits to be able to really accommodate you. We don't have to lose our touch with one another. We don't have to get behind on your normal healthcare. We can do this virtually. If you haven't tried a virtual visit with us, please call us and do so. It's been working really well for us. We miss our virtual hugs, but it's been working really well for us, or my real hugs. Wash your hands. Remember when we looked at the coronavirus, we talked about that outer shell. That's a lipid outer shell, guys. Any soap, I don't care how cheap it is basically going to bind to that lipid layer and it's going to destroy that virus. So every time you walk in your house, wash your hands. Every time you feel like you might have sneezed, just get up and go wash your hands. I will tell you, soap and water is the way that we go to really reduce viral contact. Wearing a mask. There's a lot of question about wearing masks right now. I think that if you're a healthcare professional, I think if you're someone on the front lines, then a mask might be worthwhile. But remember that the masks that we really need have to be very tight fitting. And the surgical masks that we have don't have that. For my nurses, for my doctors that are patients here in our office, we're strongly recommending that you wear your N95 mask. And because there's such a shortage, wear the surgical mask over that. Replace and throw away your surgical mask so that you can stay safe. Please don't rely on just the surgical mask alone. Viral particles can get in there very easily because they're so small. So what else can we do, guys? Okay, what are things that are immune burdens? Nobody wants to hear this, I know, but stress is one of the biggest immune burdens that there is. How many times have you guys gotten stressed out and then you get sick, right? That's a very real thing. So keep stress down, belly laugh every day. make sure that you're sleeping. I still can't understand this lack of sleep, especially with our kids and even with our adults. Remember, adults are supposed to get 8 solid uninterrupted hours of sleep every night. Kids should be getting 10 to 12 solid uninterrupted hours of sleep every night. Put the cell phones and the gadgets out in the hallway or downstairs, and get sleep. Stay away from sugar. I know that you hear this from me every single day, but we've just got to stay away from sugar and useless refined grains because they are going to increase risk and burden on our immune system. If you know that you have a food sensitivity, if you know that you are sensitive to gluten or dairy or corn, stay away from those things. Eat well right now, right? Move well, because sedentary life is also a huge risk for your immune system. Worry, anger, fear, these are things that this virus is breeding in America. Hate, even. Put those things aside. Find joy if you can. So, what are the things that will really help with immune health? Eat well, sleep well, move well, poop well, stress well if you can. And if you can, try to eat dinner before 7. Try to eat breakfast after 7. And remember, breakfast is how you break a fasting period. And so for you guys, make sure that you get a healthy breakfast. Get a veggie in there, get a good protein in there. Try not to wake up and eat sugar in the morning. And so these are the ways that I think that we can really stay well. So let's talk about supplements that we can take. I think that what we should be taking on a daily basis are things that are immune modulators. What do I mean by an immune modulator? I don't want someone taking every day something that ramps up your immune system or ramps down your immune system, right? We want things that make our immune system smarter. So if virus walks in the door, our immune system says, attack that. But if pollen walks in the door, or if you have an autoimmune disease, your immune system can say, hey, that's your own body, or that's just a plant, calm down. So the things that make your immune system smarter, there's not a lot of them, guys. Vitamin D, probiotics, and fish oils, I think everyone should be on those. If we've talked to you as practitioners about doing things like low-dose naltrexone or SBI Protect, please be diligent with those things right now. Those are also things that help your immune system be smarter. Reacted zinc, I'm not quite sure if zinc fits in this category or the next one. I think it fits somewhere in between, because it might be something that we might take now a little bit more definitively just to really keep us well protected from the virus, but certainly something that we want to be doing if we're symptomatic. So what do you do if you're symptomatic? This is the place where you take things like Echinacea Synergy or Viracid or elderberry or oregano or all of these wonderful antivirals that you guys are buying up and we're running out of. Make sure that you're taking these things only if you need them. Echinacea, for example, is going to rev up your immune system. A steroid or an inhaled corticosteroid is going to reduce your your immune activity, right? So use these things if you need them. Use them short term. Ask us what the dosing is for these for your particular situation. But that's where these types of things come into play. Antivirals like elderberry and oregano and monolaurin, and there's so many of them out there that we could be using. We do not know if these things have activity against SARS-CoV-2 and will help protect you from COVID-19. What we know is that if you've got a viral infection and you take these things, oftentimes your span that you're sick can get shortened. But once you're better, please stop taking these. Fever reducers. Try to take Tylenol over ibuprofen. Remember, because of the activity on the kidneys, we want to be as protective on the kidneys as possible. And that's the reason why we want you to do this. So remember that renin-angiotensin-aldosterone system. ACE2 receptors are activated in people that have high blood pressure, insulin resistance, and that's where SARS-CoV-2 is binding in the host cell. This is the reason why we think that maybe there's more men that are being affected by this than women. This is the reason why we think that more of our elderly are being affected. And there's some stats that are saying that Americans are being affected younger than some of the rest of our cohorts in the world, because we tend to have a little bit higher hypertension and insulin resistance and diabetes. And so there's a lot of that we'll find out as we go along. So remember too, that as blood pressure goes up and as that ACE2 receptor is being activated, that there is a huge inflammatory response from this virus. And it's that inflammatory response that's really keeping our ERs and our hospitals so busy. They're calling it a cytokine storm. So hopefully we've been talking to you about inflammation, cardio-CRP levels, SED rates, autoimmunity, the things that your clinicians have been telling you to do these things as to your best of your ability, because that is how we're going to keep you from getting really sick. So remember, be well and make sure that you know that we are here for you and that we're here for you if you need help with stress, panic, fever, cough, shortness of breath. Call us and keep us posted on how you're doing. We want to be in this thing together, and I know that together that there is hope and that we will get over this, and we'll get out on the other end smarter and wiser for the wear. So that ends video 3. We'll see you for video 4. Thanks so much, guys. Take care.